Today's letter of the day is J, and we're going to be talking about jumper's knee. Jumper's knee is also known as patellar tendonitis. This is a painful condition in the knee and is often in athletes that jump a lot, like basketball players, volleyball players, high jumpers, and long jumpers. When we look at the knee, we can see here is the patella, which is also known as the kneecap. We have the tibia and fibula over here, and then the femur. The patellar tendon attaches to the patella as well as the tibia. When we have jumper's knee, oftentimes the pain is below the kneecap, and you can see this redness in the patellar tendon to depict that. If we look at the side view, we can also see here the kneecap, femur, tibia, and how that patellar tendon attaches to the tibia. That inflammation is going to occur right here below the knee. Sometimes patellar tendon can lead to what we call Osgood Schlatters disease, which is something that happens in a younger population when the growth plates aren't closed yet. The Osgood Schlatters lesion will look like a bump on the knee. If we take an x-ray of that knee, we're going to see a little bit of that bone pulling away. We have the growth plate right through here, and because that patellar tendon keeps pulling on the bone, it starts to separate and causes this bump and lesion, which is the Osgood Schlatters lesion. We have pain and soreness right over the lesion, so if we press on that spot, it's going to be painful. If this is left untreated, whether it's patellar tendonitis or the Osgood Schlatters lesion, the patellar tendon itself can start to have micro tears, and more severely, it can actually lead to a tendon rupture. One common treatment for either Osgood Schlatters and patellar tendonitis is to have this Chopat strap, which applies compression to the tendon here and actually takes load off of that tendon. Jumper's knee is often classified as an overuse syndrome, which means there's too much repetitive stress being put on that patellar tendon itself. So things that we will typically do for someone that comes in the office with jumper's knee is strengthen around the knee, making sure that all the muscles that should be strong are strong. If there's anything that's too tight, whether it's in the quadriceps muscle, we can do muscle releases, active releases, scraping techniques such as instrument-assisted soft tissue releases. We can do kinesiotaping over the area, and then also we can provide class 4 laser treatment to help with decreasing any inflammation in the area, as well as speed up the healing if there's any micro tears within the tendon or muscle.